Let's look at a really interesting situation now of a patient who we've been monitoring the implants over time, actually a long time. In 2015, he came to the office with tooth number 7 having a root fracture and tooth number 9 showing root resorption. Both of those areas were infected, both of them were terminal, so the teeth were extracted and 2 implants were placed, and they were provisionalized in 2015. The patient disappeared from the practice, but 10 years later, he came back and he wanted to get his final restorations. So there were some aesthetic things we wanted to accomplish at the same time. He had a reverse smile line, and we were going to do restorations from 7 to 10, which took care of the 2 implants, and do porcelain veneers on the other 2 teeth in order to satisfy the aesthetic needs. Now, let's take a look at how we determine whether these implants are strong or weak. We have mobility, which has been FDA cleared, and we have the normal fit error, which is under evaluation by the FDA currently. The mobility number lets us know osseointegration-wise whether or not that implant is really strong and stable in the bone. The normal fit error lets us know about localized mobility, just a portion of that might be moving. So there's 2 different things that we're looking at. So what are we going to do? We have some clinical choices. We could either hold the patient in provisionals longer, or because we don't see any signs of infection, and it appears as if we have some fairly good bone coverage, we could restore them and just realize they're weak implants. Keep the occlusion light, make a protective occlusal splint to protect against nighttime clenching and bruxing, and perhaps provide some mineral supplements to the patient because his history that he shared with us was that he lost 100 pounds in that time period that he had been away from us. And perhaps there was some mineral needs, in his bone. And then we'll monitor for changes. So the important lesson from this particular instance is weak does not mean unhealthy. So let's test this patient. Here we are after 10 years of being provisionalized, and you would expect those implants to really be well integrated. But in fact, both implants show high mobility of a 73. We know that over 57 is getting into weaker bone. But interestingly, this other aspect, this other metric, the normal fit error, which shows localized mobility, was extremely low. Number 7 implant was a 34, 10 was a 30. That means that implant abutment was tight onto that implant. So it's not a localized mobility problem. It's an overall osseointegration problem. So here we see the mobility numbers of 73 showing weaker osseointegration of both implants, and the NFE showing that, yes, that abutment was really tight because they were both down at 34 and 30.